I'm Emma Robson, and this is my campaign against drunk driving called Drive Hammered, Get Nailed. We're going to start with some staggering statistics. Every day, about 28 people in the United States die in drunk driving crashes, which equates to one person every 52 minutes. Studies show, on average, more than 10,000 people die every year in drunk driving crashes. Men are more likely to be involved in drunk driving accidents. The statistic for this is 21% of men were drunk in these crashes compared to 14% for women. Neurological effects. When the blood alcohol content increases, the depressive action of alcohol extends downwards to the lower regions of the brain and affects the GABA receptors. Alcohol creates a dependence in the brain by the influence on dopamine-releasing neurons in the nucleus accumbens, which is a part of the brain. Alcohol is a central nervous system depressant, which means that it creates a tranquil effect or a relaxation. Alcohol depresses areas of the brain that would be an inhibitor normally. This is why people who drink alcohol show more aggressive and violent behaviors. These depressions lead to a decrease in inhibition and thoughtful decisions. This is also why when people drink alcohol, they don't make the smartest choices. Physiological effects. Some of the physiological effects of alcohol include toxic reactions, sleep effects, hangovers, pregnancy effects, and interactions with other drugs. Let's start with toxic reactions. Death by asphyxiation if blood alcohol concentration levels are elevated is common, even if someone passes out before drinking too much alcohol. When I write this, I mean that if someone were to drink alcohol before going to sleep and they fall asleep on their back, they have a high probability of vomiting and choking on their own throw up. As for sleep effects, when one consumes alcohol, REM sleep decreases. I inserted a graphic at the bottom that shows the 4 different stages of sleep, and these include awake, light sleep, deep sleep, and REM sleep. As you can see, REM sleep is the deepest part of your sleep. So if alcohol messes with this portion of sleep, you're not going to get as good of rest at night. As for hangovers, hangover side effects include headache, nausea, fatigue, and thirst, along with an unpleasant and sick feeling. Alcohol also interacts with other drugs. For example, drinking alcohol while on birth control decreases the effectiveness of the birth control. As for pregnancy effects, if a mother is to drink alcohol while she is pregnant with her child, then her child is at a higher risk for mental retardation or fetal alcohol syndrome. What is alcoholism? According to the Mayo Clinic, alcoholism is a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, having to drink more to get the same effect, or having withdrawal symptoms. A higher tolerance for alcohol means drinking more alcohol to get the same effects. For example, if somebody drinks 1 or 2 glasses of wine at the beginning of drinking, then the more they drink over time, they're going to have to increase this intake to get the same effect as it would at the beginning of their drinking. Drinking every day can lead to a dependence on alcohol and adverse side effects within the body. Alcoholism is also a strong craving or urge to drink alcohol. Or people oftentimes give up hobbies or social activities just to drink. Lastly, alcoholism is being unable to go without drinking, even if it is just for a night. Alcohol's impact on violence. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol was involved in about 86% of homicide offenders, 37% of assault offenders, 60% of sexual offenders, up to 57% of men, and 20% of women involved in marital violence, and 13% of child abusers. Obviously, there is a clear correlation between alcohol consumption and violent behaviors. And I already talked about this previously when I stated that alcohol inhibits parts of the brain that would usually suppress the aggressive behaviors. Alcohol's impact on aggression. There are 2 theories that the book covered, the first being the disinhibition theory. And this theory states that consuming alcohol impairs the brain mechanism which stops people from showing aggressive behavior. For example, someone who consumes massive amounts of alcohol can possibly release pent-up aggression which has been festering over time. Even if this person is not an aggressive person usually, if they drink alcohol, they are more likely to become aggressive. The second theory is the cognitive expectation theory, which states that learned beliefs or expectations about alcohol's effects can facilitate aggressive behavior. Basically, this means that if you go into drinking alcohol knowing that it causes aggression, then you are more likely to become aggressive or violent yourself. Blood alcohol concentration and effects on driving. According to the National Highway Traffic Safety Administration, if the blood alcohol concentration is 0.02%, then the person has a decreased ability to multitask and decreased visual function. If someone's blood alcohol concentration is 0.05%, they experience a decrease in coordination, reduced response to emergency driving situations, and a difficulty steering. If a person's blood alcohol concentration is 0.08%, they experience impaired perception, reduced concentration, and lack of speed control. And keep in mind that a blood alcohol concentration of 0.08% is what people receive DUIs for in every state. When people have a blood alcohol concentration of 0.1%, they have a reduced ability to maintain lane position and brake appropriately. And lastly, if people have a blood alcohol concentration of 0.15%, they experience a substantial impairment in vehicle control, attention to driving tasks, and decreased visual and auditory information processing. As you can see, as the blood alcohol concentration increases, people's ability to drive decreases and they become less effective drivers. Alcohol's impact on driving. Per the last slide, driving under the influence has predominant effects on effective driving. As the blood alcohol content increases, the less someone is able to drive safely, which is an inverse relationship. The more hindered the ability of someone to drive, the more likely they will be involved in an accident. For example, say you go out one night and you drink 1 or 2 drinks. That person may have some impaired driving function. However, if someone has 10 to 15 drinks when they go out, then they have very drastically impaired driving function and there is no way that they can be using a motor vehicle. DUI penalties. DUIs are given in every state if the driver's blood alcohol concentration is above 0.08%. However, some states do have a no tolerance policy for driving with a blood alcohol concentration above 0.0%, especially for people under 21 years of age. Also, according to the Arizona Department of Public Safety, a first offense DUI results in a minimum jail sentence of 24 hours up to 10 days. The second offense results in a jail sentence of 30 to 90 days, and a third offense results in a minimum jail sentence of 4 months. License suspensions are usually around 1 year for either first, second, or third DUI offenses. Some responsible drinking tips. So if someone is to participate in drinking, it is important to remember to drink in moderation if you are of legal drinking age, which is 21 years old in the United States. Do not drive after consuming any amount of alcohol, no matter how sober you may feel. You can go out one night and only drink 2 drinks and think you are completely sober and fine to drive. However, if you get pulled over and the officer finds your blood alcohol concentration above 0.08, then you are going to get a DUI, and you are putting other people's lives in danger. Another option is to choose a designated driver who has not consumed alcohol. Before you go out, pick someone that you know is not going to consume any alcohol and have them drive you home after you are done. There are also many services nowadays, such as Uber or Lyft, that's just a click away from getting home safe. Lastly, if someone has been drinking, do not let that person get behind the wheel or even take their keys and give them to a responsible party. Letting someone drive under the influence is just as bad as driving under the influence yourself. If your friend drinks and drives, then you are also responsible if you let them do it, because they are still putting other people's lives in jeopardy. Education. There is a high importance in educating the youth on the implications of drunk driving. If the youth are aware of the negative effects of alcohol and the dangers of drunk driving, more people may refrain from driving under the influence. It's important to stress the impact drunk driving has on other people's lives. For example, you can make a comparison. Say that one of your loved ones died in a drunk driving accident. Then you could say that, what if you drove drunk and you killed someone else's loved one? How would that make them, their family, feel? Also, it's important to stress that drunk driving is not worth the negative consequences when other options are available. When I say other options, it is all the things that were listed in the previous slides, such as choosing a designated driver or using driving services such as Uber or Lyft. Lastly, according to the CDC, school-based programs are effective at teaching teens not to ride with alcohol-impaired drivers. Because once again, if you are riding with an alcohol-impaired driver, it is just as bad as driving drunk, because you are still putting other people's lives in jeopardy. Treatment options. When you know someone that is experiencing alcohol abuse or alcoholism, it's important to remember that no one treatment option is the right option for everybody, and it is very important to be understanding. There are different types of treatments, which include behavioral treatments, medication, support groups, and primary care intervention. Starting with behavioral treatments, the physician attempts to change the behaviors that lead the patient to drinking. The patient and the physician set goals, and they get to the root of the problem. As for medications, drugs such as naltrexone can help reduce heavy drinking, or ecamprostate makes it easier to maintain a sober state, meaning that it decreases the withdrawal symptoms. There are also many support groups available for those experiencing alcoholism, one being Alcoholics Anonymous, which allows people to talk about their addiction in a group setting and to know that they are not alone. One of the most important things when dealing with substance abuse is knowing that there are other people in the same position and getting with those people and talking out your problems. Lastly, primary care intervention is a possible solution to handle alcoholism and alcohol abuse. Going to a primary care doctor and setting up a treatment plan to help alcohol abuse is very necessary in some cases. For example, if you are going to your yearly checkup and you are comfortable with your primary care physician, you can let them know that you're struggling with alcohol abuse, and then you and your physician can set up a treatment plan to help you through it. Numbers to call. First, I have Alcoholics Anonymous, then Smart Recovery, third, the National Institute on Alcohol Abuse and Alcoholism, fourth, the NAADAC Substance Abuse Professionals, and lastly, the American Society of Addiction Medicine. These are all coupled with phone numbers and websites for people who are struggling with alcohol abuse or alcoholism. Also, these are only some of the many options available for alcoholics or alcohol abuse issues. Lastly, I have my references, but I just want to leave this off by going back to my slide about the staggering statistics. Every day, about 28 people in the United States die in drunk driving crashes, which equates to one person every 52 minutes. Studies show, on average, more than 10,000 people die every year in drunk driving crashes. I think it's important to end this presentation by saying that it's not worth it to drive drunk. There are so many other options available nowadays, and driving drunk and putting everybody else's lives in jeopardy is not worth it. Thank you.